Hello, everyone. This is Bob, recording this as a follow-up to our meeting today at the College of Public Health. And basically wanted to throw this out as a second version of the draft and see if this is the pitch that we're all ready for prior to our next meeting and for our next steps. So we've been calling ourselves the Align meeting. Although it's capitalized, it doesn't stand for anything. I had that question recently. And then Dale Michaels suggested Nebraskans for Better Health as another title. Essentially, this group has no real ownership, formal capacity, or we don't even have a name yet, but this is kind of what we generally want to do. I think all of us are meeting because we do like the goal of reversing Nebraska's slide in America's health rankings and moving Nebraska back to its place in the top 10. So unfortunately, as many of you know, we've been sliding for quite a few years now. We used to be in the top 5, but unfortunately we're not anymore. Our worst areas are in health disparities, binge drinking, but also some other worrisome trends as noted: obesity, diabetes, low birth weight. We've been losing on a lot of things, unfortunately, and a lot of us would like to reverse this trend. So health disparities, here's a good example on mammography screening, for example. This is based on Medicare data. Unfortunately, our only common source of data of the state right now that's comparable and readily available is Medicare data. What you see here is huge disparities in cancer screening across the state, almost twofold variations from the essentially the better screened areas versus the worst screened areas. This is also part of our healthcare system, and I think some of us want to try to make this part of the issue as well. Ted Frazier here at Healthy Lincoln actually created this map out of the Medicare claims data showing the primary care spend rate, which happens to look just like that mammography screening rate, shows that the primary care spending varies threefold across the state. Why is this? I think it has mostly is because of the CPC Plus program. A lot of these clinics in this area got into the CPC Plus program. Unfortunately, Medicare wrote out rural health centers and federally qualified health centers, so a lot of folks in the rural areas couldn't apply to that program, which was a significant decrease in funding, which didn't allow them to get into the CPC Plus and do this quality improvement. I think it's no accident that you see this is probably contributing to one, our primary care supply, but also our health disparities across the state. So if we're going to reverse these disparities, we should have some common approaches. We need a statewide coalition, I think, to make this to reverse this slide. You'll see this, and it's not just mammography screening. So influenza vaccination, again, a twofold variation in vaccination rates based on Medicare claims data. This is kind of timely now that we're looking at, flu shots is just once a year. What are we going to do if coronavirus is the real deal? Do we have the infrastructure to respond to that? And unfortunately, this might not be the case in Nebraska. Also, disparities in colorectal cancer screening rates. So as you know, these are all a lot of these are quality measures that we all work on through our value-based purchasing, ACO, medical home, CPC Plus contracts. We all use these measures. So could we, as a state, work on all these agreed upon measures collectively? If we can put these within our insurance plan contracts, we could potentially reverse our slide in America's health rankings. And so this is the list of measures that everybody's agreed on over that as we've been getting consensus over the last year. There's a grid strong public health reasons to pick all of these, and a lot of these do have well-defined measures that we could use and put into current contracts. Our first example is the Medicare ACO contracts that have been in place in Nebraska for 8 years now. We now have 9 Nebraska-based ACOs plus several clinics who are part of national groups like Caravan, for example. The good news is that when you look at this map, you'll see lots of green, and if you go down the whole set that I've sent out before, this is all publicly available. We know that all of our ACOs are doing a great job on all these measures for Medicare population at least, and so most of these are urban though, unfortunately, so that's why you're seeing a lot of improvement in the urban areas but not in the rural areas in Nebraska. So it's good that the urban areas are getting better, but it makes the disparities potentially worse. We're leaving the rural medicine behind. We need to find ways to bring rural medicine along. Blue Cross Blue Shield also has similar measures now that they're doing on. So our two of our biggest payers, Medicare and Blue Cross, are doing this. Now we need to get United Healthcare, Aetna, and the Medicaid plan along. If we could get this consistent and statewide, I think we could easily reverse Nebraska's slide in America's health rankings, potentially within just a couple years. So the starting point, we right now it's basically what, for lack of a better term, a coalition of the willing people who just who are willing to take time out of their day to do this. At some point, we need a common neutral convener who's independent and to bring together everybody and to do this and enact it. Other states have similar entities. They're typically either a 501c3 like Iowa Healthcare Collaborative or a non or an independent entity. Arkansas Center for Health Improvement is technically under the University of Arkansas Dean's Office, if I remember correctly. But it's an independent entity that can bring everybody together. It doesn't work usually well if it's a partisan entity. That group could bring together an independent advisory board, which is essentially the people who've been meeting willingly already. But they also need some staff with extensive experience in health data and health policy to make this work and to convene this and get it turned it into reality in the next couple of years. Needs, also we're going to need a more complete and timely health data set. Potentially NEHI could serve this role. There's also other data sets, the statewide immunization registry could fill this. A multiplayer or all-payer claims database could do this, because essentially that would include cancer screening rates, diabetes control, blood pressure control, all these measures where we need to make some progress. And we need to have some active monitoring. Another place might be vital records, where all birth outcomes, so we could use that to track timely access to prenatal care. And the most important thing for this to work is to put this within our health insurance funding system. So we need active participation of all Nebraska health plans, not just Medicare and Blue Cross. If we could do this, I think we could easily reverse the slide in America's health rankings. And so if we could continue this sort of coalition the will and formalize it, get it some funding, I think we could reverse this. So we've had a whole bunch of folks. If all of you would be willing to sign on to this, I think it helps that you have people from various entities already signed on. We've got about 20 to 30 people who've been coming on a regular basis. So one thing is, would all of you be willing to sign on to this project and this effort in Nebraska? I think it's doable, and I think it's achievable, and I think we could, if we could all formalize this, reverse our slide in America's health rankings.